I'm Dr. Miodrag Todorović, medical doctor, by education cardiothoracic surgeon, but actually founder and owner, executive director of the Panafricare company that is registered in Seychelles. After years of high and very complex surgical procedures, time spent in theaters and so on in different countries, my preoccupation actually, I'm completely taken with the developments in the digitalization of medicine in particular, with the introduction of miniaturization of the equipment, accessibility to this technology, point of care diagnostic, which is producing results immediately. So taken by this all, I'm now dedicating my time to this field. Seychelles is a group of islands. It's an archipelago in the southwest Indian Ocean, 116 islands, smaller and bigger, with small and bigger communities on this island dispersed in the ocean, and sometimes only a hotel, big resort with employees and small community. But all of them, they need a good doctor, good consultation point or service aided by distance on the spot. But it's not always easy to organize this by physical communication and having in these resorts everywhere somebody who will help the community. And this is why we are developing, thanks to very good connections with the internet of the Seychelles Island through underwater cables, through the ocean and so on. We can provide internet communication and, let's say, virtual clinic on these places where the coverage may be total and accessibility in the communities also total. So this is something that is for Seychelles important and interesting at this moment. Otherwise, the health sector covers the same problems that in all over the world, dominating non-communicable disease, chronic non-communicable diseases, cardiovascular, diabetes, complications of it, cancers and so on, the same pattern. The new medical knowledge is nowadays very quickly spreading around the world. And this is something that is an amazing difference compared to the days when people had to travel far away, looking for special educational programs, universities, famous places, or even the simple distance to travel. From Seychelles in the past, people had to take the boat to Mombasa, to Kenya, from Kenya in hip hops to Europe for education. This is nowadays totally different. Accessibility to the networks, to digital knowledge, which is helping in spreading other knowledge. This is something that is widely present, and I think we cannot compare. Some people have already forgotten how it was in the past. Yeah, medical profession in continuous learning is another area which is already long back established as a even legal obligation for medical professionals. You have in a period of time to accomplish or to present your continuous professional development or medical education first through presenting hours of attendance, topics that you already achieved or covered in your education. But future of artificial intelligence and education in the new technologies will be able to evaluate your continuous medical education through not only number of hours that you spend in front of the screen, but analyzing your perception, analyzing your impact of that education through your psychological and responsive manner. It will be possible to accredit your knowledge and success of that distant education. This is why I think the new technologies are bringing much more, spicy educational points into the life and professional achievements of all medical professionals, regardless if they are doctors or nurses or other technical staff. In terms of artificial intelligence and education, I'm so excited that something that was in the middle age, let's say, privilege of royal family, that somebody has a private tutor. Now everyone can have a private tutor, and everyone can feel royal in that matter, that the system is dedicated to him, is analyzing his own capacities, is adjusting the program to your own fitness for that matter, and so on, can advise, can train, and can evaluate the impact and your knowledge. This is something fantastic. This makes the future of everyone accessibility total, and not only individually, but all around the world present. So this is one of the probably best democratization of education.